Hello everyone, I am Dr. Archana Daftardar. I am a nephrologist working in Renova group of hospitals at Kompally. Today I am going to discuss about the diabetic kidney disease. As we all know, diabetes is the most common health condition which is seen all over the world. And the kidney disease occurring in the setting of diabetes is called as diabetic kidney disease. The diabetes, as the number of diabetic patient is increasing, the burden of kidney diseases is also increasing. In the kidney disease, there is something called as chronic kidney disease. That means there is a decrease in the functioning of the kidney in the form of filtration capacity, as well as there is an excessive excretion of the albumin, which is a kind of protein which usually will not be excreted in the urine. So when this kind of scenario remains in a diabetic patient for at least 3 months, it is labeled as a diabetic kidney disease. Diabetes is broadly classified into type 1 diabetes and type 2 diabetes. Let's see what is this. So type 1 diabetes is the disease which happens which starts in the children, and it is because of the absence or very less quantity of the insulin hormone due to the genetic defect in them. And type 2 diabetes happens in early adulthood, or it starts from the early adulthood. So in type 2 diabetes, either the insulin is in the lesser quantity, or there is a resistance to the insulin which is secreted in the body. So the kidney diseases happening in type 1 diabetes and type 2 diabetes are to be seen different ways. Let us see what are the symptoms of diabetic kidney disease. Unfortunately, there are no symptoms in the early stages of diabetic kidney disease. Unless the 80% kidney function is lost, the symptoms will not happen. So this disease has to be detected biochemically, that is with the help of labs. So how to diagnose this disease? So there are two simple tests by which it is diagnosed. That is testing the urine for protein or albumin, particularly albumin leak. And the second thing is estimation of the GFR, that is the glomerular filtration rate, which is checked by checking the blood. In type 1 diabetes, usually these tests are done after 5 years of the detection of the type 1 diabetes. That is the time when the occurrence of diabetic kidney disease can happen. While in type 2 diabetes, the diabetic kidney disease can be present even at the time of diagnosis of the diabetes itself. So early detection of diabetic kidney disease helps in prevention of the progression of the disease. Let's see what are the risk factors for this diabetes kidney disease. As we all know, when the sugars are not under control, they can lead to all sort of complications. So uncontrolled diabetes is most important risk factor. Uncontrolled blood pressure associated with diabetes is also a second risk factor. Associated obesity, smoking habits are also the associated risk factors. Presence of the retina effect of diabetes, that is called as retinopathy, is also considered as a risk factor for occurrence of the diabetic kidney disease. So how to prevent this? So control of sugar, control of blood pressure, quitting the smoking, controlling your weight, keeping the healthy lifestyle. These are all the measures which we can take to prevent the occurrence of diabetic kidney disease. And most important is the early detection of the disease, so that certain medicines can be added which are called as antiproteinuric drugs, that is AC inhibitors, ARBs. These are the particular drugs or specific drugs which can be protective for the kidneys and which can delay the progress of this disease. I would like to highlight one misconception about diabetic kidney disease. Many patients say our sugars are under control, then how can I get diabetic kidney disease? Surprisingly, there is no relation of the control of sugar or the controlled sugar and the occurrence of diabetic kidney disease. Even if the sugars are under control, the diabetic kidney disease can happen. But with uncontrolled sugar, the progress becomes very fast.